Yes, she's just arrived. And then we have our official opening ceremony. Thank you so much, Dr. Iman. We had an apology this morning, and the apology was with our County Executive Committee. And as we are here, we are hosted by ECK Mount Kenya, but the county actually is aware that we are here. So I want to invite my good friend, the CEC Keugoya County, George Karoki, who is a very good and dear friend of mine. Thank you for coming. He had another meeting, but he purposed to be here. So karibu sana.
Thank you very much. Good afternoon. Oh, sorry, 1 minute to the afternoon. So therefore, good morning. Yes, my name is George Karoki, as it has been put by my very good friend and gynecologist, Dr. Jagi. Let me start by saying that I'm quite impressed that we are here. And I've heard the guest speaker stating that really is not really aware whether this is aware that we are having such kind of an occasion. I think we are quite grateful. And as a county government of Keugoya, I think you are quite aware that we usually have what we call collaboration with our private facilities. And therefore, this kind of initiative that is done through Dr. Jagi and others, he started it quite some time back. And we are very happy for this particular collaboration. Because as it has been stated, of late issues to do with HRH, that is human resources, it has become, at all order sometimes to have certain particular, specialists or consultants. And therefore, this kind of business that we are doing in terms of telemedicine, I think is a good thing for us as Africans, as the world. Because as you are aware, some of the families in our country, they may not reach that level of meeting some of the obligations in their particular families and backgrounds, and therefore, when it comes to health, you find that there shall be a shortage in terms of meeting their needs. And therefore, this kind of initiative that we have is a great one, and we are happy for Dr. Jagi and the team because he has really put a lot of efforts and investments in this particular business, and we have seen where we have come from. In fact, I was one of the fellows who was supposed to benefit through my wife doing this particular laparoscopy. One time that we had seen that now we are closing off in terms of, having more children. We had already 2 children, and therefore I brought her for that laparoscopy that we are doing sometimes in Keugoya Hospital. And Dr. Jagi, let me be very clear to you that if it happened that time, I wouldn't be having my last born boy. I got later. Because when we came with my wife, and she was really ready to go and do delegation, when we came and she found somebody that they had crossed in the past in that particular team, and she said, "Oh no, today I think I hesitate. I retract today," and that is where I got a blessing to have another young boy at 50 years. I got a boy at 50 years who is now 7 years. You can have a clap for that one because really, although the laparoscopy happened later. But I want to thank you people because those particular numbers and issues to do with this particular outreach is great for us as a county. And that is why I'm taking this opportunity to welcome all of you, our partners who have come far and beyond in other countries really to come and support us. It's a great thing for us as a county department of health, and therefore on behalf of the administration of Keugoya County, including Her Excellency, the Governor, who is so concerned about the health and more so of women in Keugoya County. She has welcomed you through proxy or through me really, and therefore can you give her a clap because it's really for the women. She is out there for them. When we were doing our complex that you find here, which is a new status of the art county referral hospital, she was very uncomfortable that we had done a design that did not accommodate a maternity ward in that particular complex. And therefore, what did she have to say? That you must have to go back, knock down those particular walls and accommodate a theater, accommodate, a maternity ward, and accommodate those other wards that women must be taken care of. And therefore, we had to go for that also. We knocked the wards and we put up that particular ward. So therefore, when it comes to the matters of laparoscopy and taking care of women, endometriosis, and this kind of an outreach, we are so grateful as a country, as a county, and therefore we welcome you and say that any other time that you have a space to do this, we are willing to support you and whatever is required, because we are really collaborating with our private facilities, we are serving the same communities, and we are doing the same thing to everyone in the world. Of course, as I finish, I want to state that our country is one of those particular countries that are now attempting to do what we call, universal health cover. And as you are aware, we are trying really to make sure that primary health care is provided for free in the country, and we are in a position to do that. And then from the level 4 going up that way to level 6, that we should be able to have the insurance that is through SHA to make sure that our populations will get the services for free. And therefore, I wish to welcome you and say thank you very much for this particular support. God bless you.
Thank you very much, sir. So yes, now I would like to call in the faculty, my international faculty and all the local faculty on the stage, as we have our official opening ceremony, and then we take a break and then carry on with the deliberations of the day. So my faculty, please join me up here. Endo is debilitating and life-altering.
Okay, huyo bwana na msinichom. Ngoja kwanza. Mimi napiga piga.
So I hope all of you have your candles. We want to just launch the event with the candle lighting ceremony, and then we officially start this bootcamp going. If all of you could please stand up and ministers. So this is to the Wheeling Mama Africa bootcamp. Let's start this bootcamp with blessings from the Lord and pass this on to the Mama Africa who leads us on. With this, thank you to all the faculty standing here with me and to all of you. We officially have this Healing Mama Africa bootcamp open. Thank you very much, and congratulations to the whole team and my brother Joe Jami. Thank you. Officially open. So that in the background is the folk song, the endometriosis folk song. Are you ready? So again, officially setting the Healing Mama Africa bootcamp in Keugoya, Kenya, open. Thank you. Officially open. Yay! Come on!
Put off the candle. You don't want a fire. Please put off the candle. Give them back to the usher. Give the candle back to the usher. Kindly. So we are going to take a quick break. As we continue with our photo session, we are going to take a quick break for 20 minutes. We only have a break for 20 minutes and then we can come back.